My name is Dr. Chemtai Mungo. I'm an assistant professor of obstetrics and gynecology at the University of North Carolina in Chapel Hill. So January is Cervical Cancer Awareness Month, which means it's an opportunity that researchers, clinicians, health educators use to remind the community, the global community, that what cervical cancer is, and that it is one of the cancers that is completely preventable, and we have tools to prevent it. We are trying to continue to pass the message of vaccination and screening to prevent cervical cancer. One thing that nurses need to know is that cervical cancer, unlike other gynecological cancers, it's a cancer that we understand very, very well, and we can prevent. In fact, we can eliminate. In 2018, the World Health Organization came up with a call to eliminate cervical cancer, meaning if we vaccinate 90% of girls by the age of 15 against HPV, which is the virus that causes cervical cancer. We screen 70% of all women globally for cervical precancer because we know we can catch precancer early and treat it. And if we treat 90% of those women who are screened and found to have precancer, we can eliminate cervical cancer, meaning globally, it would be very rare to see this disease. And it's very exciting to be able to have the tools of vaccination and screening. So unlike other cancers, like ovarian cancer, for example, we're not very good at looking for it. We can't vaccinate against it. Cervical cancer is a cancer that can be completely prevented through vaccination of girls and boys to prevent HPV infection, and then screening to find early changes. So, nurses interface with patients, women and men, throughout our health system. If we can continue to pass on that message of prevention, specifically taking up the vaccine, which in the United States is still not as high as it could be, and screening for women who either have never been vaccinated or even have been vaccinated, we can get to a world where no woman dies from cervical cancer or even gets cervical cancer. The single visit screen and treat strategy is a strategy such that some women, based on their test results, rather than having multiple visits where you have a screening visit and then you come back, you do more investigations, and then you come back and get treatment, based on their screening results, they can be able to get treatment immediately. And this is important, especially in rural areas or in places where women have to take multiple buses to come to the clinic or to reach a health provider. It's logistically challenging. So as scientists, we are trying to reduce the impediments to treatment access, which can include multiple visits, multiple appointments. So in certain contexts, where a woman can have treatment the same day or as close as possible to the same day they get screening, to again reduce the chance of losing women because they have to come back for multiple appointments. Thanks to science and scientific discoveries over the last 100, 200 years, we are at the precipice of getting to a point where cervical cancer is eliminated, and it's actually quite a real possibility. And I think we want as many people to believe that and to be aware of that, especially with the fact that we have a vaccine. So cervical cancer is one of the cancers that you can actually vaccinate against, and we know, for example, from COVID, the power of vaccination. If you vaccinate somebody, you prevent them from getting HPV in this case. And countries that have embraced the vaccine wholly, including countries like Australia, that have vaccinated most of their young girls 15, 20 years ago, now are seeing no cases of cervical precancer or cancer. So, globally, we have this immense opportunity to be able to really wipe out a cancer, and it's a win for science. So if we can embrace the tools of vaccination primarily and then screening, we can get to a generation where no woman dies from cervical cancer. For nurses who engender a lot of trust in patients, use every opportunity that you have when you interact with families to ask about, do you have young sons or daughters? Are they vaccinated? Have you had screening? As health providers, we must continue to work to reduce impediments to access, especially in rural areas in the United States or in low-resource settings where there's not as many physicians or women live far from physicians. Work that my colleagues and I are doing and looking to see how we can bridge the treatment gap, including studying whether women can use self-administered treatments for women who can't get access to a trained provider. So lots of opportunities. Use every opportunity you have with patients to spread the message, and we can get to that cervical cancer eliminated world.